I think a lot of people put a lot of trust and faith in their doctors and surgeons, especially when they're about to perform a procedure on them. Some of which is done whilst the patient is under, or in some circumstances could even be life-threatening. But generally, a lot of people see it for what it is. Yes, it's a risk, but at the end of the day, the positive outcome will make such a change on your life that the whole procedure is worth it. Especially if you know that these trained, competent professionals are going to make your quality of life that much better. So, that's what normally happens, mind you. But what happens when a mistake happens? Basically, what happens when you go through a procedure and you wake up and there is a surgical tool left inside your body after the operation. So I'm going to go ahead and warn you right now, if you're eating watching this, you might want to put it on pause until you're finished. Hello! Welcome to Brain Spill, the laziest show on the internet. My name is Tank, and I know what you're asking. Tank, why are you talking about this today? Surely this is a bit of a strange topic to be talking about. Well, it's due to the fact that not only is this pretty horrifying, but also generally weirdly interesting. How something like this can happen, how a patient can wake up and have something inside of them that is not meant to be there. So, how often does this happen? When does it happen? How does it happen? How is a medical instrument left inside a patient, particularly if they don't know about it? Let's explore this very, very uncomfortable topic today. This is commonly referred to as a retained surgical instrument, an item that has been left inside the patient's body after a course of surgery. You might wonder how on earth something like this could happen. The surgeon just decides to put down his scissors, and he just so happens to leave it inside the abdomen of the patient he's working on. Yeah, I found this pretty hard to believe when I first read this, but when you find out that a typical operation like this may have upwards of 250 to 300 different tools involved, then it's easy to understand that one of those might go astray. In such a high pressure environment with so many tools going about, it's pretty easy for somebody to throw their scalpel where it's not meant to be. Okay, I was thinking about this earlier. I can probably give you some analogy for this. So you're sat having dinner at home and you're having mashed potatoes. Oh no, you dropped some mashed potatoes on you. Oh. You just kind of clean it off, you brush it away, that's fine. You've seen it, you can sort it. But there is that very rare occasion where you're eating your mashed potatoes and you drop some of it on you, but you don't realise it until you get up after you've finished, only to have a bunch of mashed potato on you. Weird analogy, I know, but that's kind of what we're looking at here. Common instruments that have been reportedly left in patients include needles, knife blades, clamps, towels, safety pins, scalpels, scissors, sponges, tweezers, forceps, suction tips, scopes, ultrasound, tissue disruptors, cutting laser guides, and measuring devices. Basically, every item I could think of when you think of a surgeon conducting an operation. Yeah, I mean, thinking about this, I can certainly foresee a situation where a very small thing might accidentally fall into a patient, such as a scalpel blade might go missing, but when it comes down to things like tweezers and scissors, something that's a bit bigger, it really does make me wonder how something like that can even be left in a patient. However, the most common thing that is actually found inside a patient when it's not meant to be there is actually a sponge. So if that question comes up on your pub quiz anytime in the near future, then just think back to this video and you can thank me. Maybe buy us a pint at the same time. All thanks to your boy. Some of this stuff does take some time to be discovered. I guess if it was found during the surgery, it might not be so bad. But the problem is when things get left in there for quite a long time. Macquarie University in Australia conducted a study on hospitals in the Victoria area where they studied reported incidents of instruments being found inside patients after they'd had operations. They determined that 1 in 6 surgical instruments accidentally left inside a patient was not discovered for upwards of 6 months, with 1 sponge being left undetected for 18 months. Whilst a quarter of all of these instances had the items found and removed on the same day as the operation, the rest of them were pretty much ones that got left for much longer, and for every single study bar 1, each of them required further operations to have the retained instrument removed from the patient's body. An operation, mind you, which would have been completely avoidable if Dr. Butterfingers didn't drop his tweezers inside of you whilst doing open heart surgery. The research has delivered some practical and immediate solutions to the problem of incidents of surgical instruments wrongly left inside patients. You're analysing real events, and that's really useful. Most surgical teams manage these devices well. It was an opportunity to look at investigations into incidents that happen rarely, understand what happened and why, and then share that in order to reduce further incidents happening again. Now, the actual study pool size of this was about 31 different cases, which in the grand scheme of things is very small. But this was incredibly useful information, mainly because of the fact that studies of this nature are actually kind of rare to come by. It's not really an area that's been massively studied before. The normal way that surgeries manage to avoid this happening is that every single time they use a various medical instrument or tool, they will have someone check it off, meaning that every time they use something, they will always account for it and make sure that it is safely returned before the patient is allowed to leave, meaning that hopefully nothing goes awry. Meaning that if you use a pair of tweezers and you're finished with them after the operation, you give them to your colleague, they'll give them a wash, and then make sure they don't get left inside your patient before they go home. This might sound like a good idea, and generally it is, but this is not a completely foolproof plan, mainly because this is reliant on humans counting it, and we all know that humans make mistakes, particularly if you're in a very stressful environment like an operation. I mean, come to think of it, if you're using a couple hundred different tools in your operation and you under or overcount by just one, that one item has completely gone missing and nobody knows where it is, or even knows it's missing in the first place. Of course, the risks posed to patients can range, from having a harmless plug stuck in you which could go undetected for many years, to a foreign object inside of you which could cause pain, nerve damage, or an internal infection. Particularly pointy items may perforate your organs, block bowel function, or even cause sepsis. Just one of the more serious examples I found was a time where a woman had 2 medical sponges left inside her abdomen for 6 years following a C-section operation. This was only found once she went back to the hospital complaining that she'd suffered from bloating for 3 years straight. They conducted a CT scan and, there you go, found 2 masses with strings attached, these being the sponges inside her body. Thankfully, they were very easily able to get these removed and she was discharged 5 days later without any long-term health problems, which is good, but also incredibly worrying for something where this could have gone horribly wrong, or if it wasn't sponges, something else that could have been left in there for just as long but caused even more damage. And of course, the doctor that did the C-section completely denied responsibility, saying that there wasn't enough proof to show that this had happened, despite the fact that there were 2 sponges inside of her off the back of the operation she'd had a few years prior. Yeah, I don't know about that one, Chief. Thankfully, we have a very accurate number knowing how often something like this happens, as the US Department of Health and Human Services estimates that foreign surgical tools are left inside patients anywhere between 1 in 100 times or 1 in 5,000 times. So, by very accurate, I mean not very accurate at all. So yeah, I just thought that this was a bit of an interesting one to talk about for a couple of reasons. One, because it's so underreported and there's not many studies on the subject, despite the fact that this could be potentially life-threatening. And 2, this is not something that the normal person would ever go away and think about. This will only ever come up in your life if either you're a patient that has something left inside of them after an operation, or you're the surgeon that screws it up and is the one that has done this to a patient. Aside from that, why would you ever need to hear about this? And that alone made me think that this might be an interesting topic to talk about. Horrifying yet curious at the same time. You know what, if all else fails, I'm just glad you found out about it this way, rather than in a few years' time where you may have an operation and something gets left inside of you. If you liked the video, be sure to like and subscribe. If you want to be notified as soon as I upload my next video, be sure to hit the bell button. And if you've got any ideas for what topics you'd like me to discuss next, let me know down in the comments below. As always, sources used in the video will be in the description. Look, if anyone is ever going to do this to me, as in leave something in me after an operation, I don't want it just to be something boring like a sponge. I want it to be something cool, something I can actually use, like a bone saw, and I can whip it out like Wolverine and actually make some use out of it. So if it's ever gonna happen, then that's all I ask. But hey, I'll see you guys in the next video. Fantastic.